Welcome to the Hair Loss Show, where Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hello everybody, welcome back to the Hair Loss Show. Vikram Jayaprakash. Today our topic is going to be the top 3 mistakes that we see in hair transplant surgery, and with the advent of many people going overseas for their surgery now into more cost-effective countries, for example, we see this cosmetic surgery tourism has the temptation to actually, because the patient comes once, to try and do too much.
Yes.
And that's one of the problems we see, right? That the patients are going there once. So we are seeing an increasing number of patients coming back, having had massive numbers of grafts done in a single session because they think more is better.
Yeah, so I think with the boom in popularity of hair transplant surgery, a lot of people are getting the procedure done. It's normalizing it, and that's fine. But with that built into that, we're also seeing a lot of issues, a lot of problems that are arising, especially because people are going to centers where they're just sort of churning through, multiple patients per day and just trying to get them through.
And just doing as many hairs as putting as many
Correct.
hairs as they can on the head without thinking about the future consequences of that.
So, if we talk about the top 3 mistakes that you are seeing when people come back and you go, it's a heart sink moment. Rattle off your first one. Let's take one each. Go. You start. You go first.
Hairline design.
Right.
So we see these generic hairlines that it's almost like a cookie cutter. They come back and everybody's got this similar hairline. So it's basically everybody gets done exactly the same way. And it's irrespective of what their facial features are, their age, for example. And so basically the problem then is that if that cookie cutter hairline is inappropriate, then what do we do? For example, only the other week I had someone come back from a country overseas with the surgery 2 months previously, and he hated what they'd done because they'd rounded off the corners so much, and it just looked unnatural. And I actually had to FUE out the grafts in the corners to give the angulation that you need in the corners to make it better. I had to undo it and relocate the grafts elsewhere. So number 1 for me is hairline design.
Yes. I think the other thing, the big thing for me when I look at that, and I think you touched on this at the beginning in your introduction, is operating on a person that shouldn't be operated on.
Yeah.
Right?
Well, they don't turn anybody down.
No. Exactly. This is the thing, and we hear it all the time. That people contact a centre and they just send through photographs, and it's just a bombardment of communication, and when they book hotels, transport, all of that, and it's just a generic hairline that's drawn, as you said. But it's the fundamental decision before that is this patient, is a hair transplant surgery appropriate in this patient? Because I'm 100% sure that this is the same for you as it is for me. Everyone that I've seen, or most people that I see that come back from having a procedure done, there's been no discussion of medication whatsoever.
Correct. And no discussion, not just about medication, but the implications in these young men of having a massive amount of hair taken from the donor area, placed here, and then no thought whatsoever as to what the future consequences were of further hair loss. So the critical thing for our audience to remember, and we get asked this question because people misunderstand this. Many people who come to see us for consultations think that if we remove the hair from here and transplant in here, that it regrows here again. I get asked that a lot. Yep. And the answer is no. We're not taking a cutting from a plant and taking it and putting it around there. We're taking the whole plant. So every hair that you gain on the top of your head is less hair, one less hair that you've got on the back of your head. And the younger the patient, the more you have to think about lifetime supply. Yep. So it's all very well to try and pander to the idea that this is what you want, and you're young, and you want as much hair as possible. Because patients say, I don't want to do medication. I want to have an operation. You want one operation. I want to be done for life. I want to be fixed for life. And that's not understanding the progressive nature of hair loss. It's a very rare patient indeed that doesn't lose more hair after a transplant.
Yes, and it's not that the whole emotional aspect of things is lost on us. It's not, and we're sort of, very attuned to that. But if you've got someone, for example, who's a 19-year-old who's losing hair, it's bound to be devastating for them psychologically. And here's an option or an opportunity for them to relatively inexpensively go and get their hairline restored, get their confidence restored. But by definition, if you're a 19-year-old that has lost a significant amount of hair, if I was a betting man,
there's a lot more coming down the pipeline.
Yeah, exactly. And so should that person be considered for a hair transplant first of all? Probably not.
No.
Yeah, not right now. I'm not saying never in the future.
Well, it's like I say to them, if balding is like a leaking bucket syndrome, leaking hairs, we've got to fix the leak. Because all surgery does is top it up, top up the bucket. It doesn't do anything about the leak. You've got more hair loss coming down. So again, it's very tricky because these are very desperate, psychologically desperate young men that we have to try and get them to understand the progressive nature of it, the lifelong nature of it. And I say to people, if we put you on medication and you walk away from it, the worst thing that can happen is that you're bald naturally. But once we operate on you, the worst thing that can happen is that you're bald unnaturally now because the transplanted hairs will stick around, but the rest won't. And then it looks weird. Yes. So if we've just filled in corners, we've got 2 triangles here, we've got 2 triangular horns, for example, with baldness in behind. So I try to say that, and I also try to distinguish when we're determining who's a good surgical candidate or not, between someone that I call premature balding versus balding. And what I mean by premature balding is if a patient comes to me and says, if I was 10 years older, I wouldn't care. I don't think he's a surgical candidate because once I touch him, he has to care.
Yes.
Right? And he has to care for the rest of his life. So I say to people when they say, well, how long do I have to take these medications? And I say, as long as you care about, hair loss. If you suddenly think 10 years later, you know what, I'm over it now, I'm not worried about it, I'll just stop taking the tablets. Well, okay, let nature have its way with you. I remember very clearly that when emotionally we invest in the patient. And I had a 19-year-old that came in and his mother was devastated that he wouldn't leave the room. He'd wear a hat everywhere. Please, please, please operate on my son. And I gave in. This was early in my career and I gave in. He came back 10 years later and he didn't want the transplant 10 years later and he was unhappy now that he had the transplant because now he had to deal with the consequences of it. And it was a very, very sobering lesson for me to think about the fact that, yes, they're in need and they're desperate, but you can do more harm than good by giving in to what they think is an easy, instant fix when there's long-term consequences.
Absolutely. I mean, I had a story, not like that, but not dissimilar as well, but which is I had a young 17-year-old that was losing their hair. Came in with their parents who said, listen, we want him to be happy. And for his 18th birthday, we've saved enough money to give him a hair transplant. And I was like, I'm sorry, this is just not appropriate. And you would hate me for it, not now, but you'd probably hate me for it in 10, 15 years.
Well, I had another patient where I medicated him and refused to operate. And you can't control them once they leave the office. So he went about a year later and had an operation with someone else and then sheepishly came up to me a couple of years later and said, I went elsewhere and I don't really like what they did and so I feel like I'm really silly, I should have listened to you. So, there's going to be always someone that'll say yes to you.
Yes.
The hardest thing to do is to say no to these people, but there are reasons we say no. If there isn't enough donor hair, in the first place, we see people with extensive baldness. The balder you are, the less donor hair you have to play with, and the bigger the compromise you have to make, right? Because if you've got X amount of hair, but you've got 3X amount of baldness, that isn't going to work. You've got to decide where you're going to use that hair and where it's going to give the patient the most benefit. So that's a challenge. Because they think that the hair regrows and they think it's that they can have more and more and more and more, and they can't. So it's a law of diminishing return. The balder they are, the less we have to play with. So premature balding is an issue for me, where I say if you think in 10 years' time you wouldn't care, don't operate. Just take the meds, right? And just deal with it until you're happy about it, and then save yourself a whole lot of grief.
So with regards to the top 3 mistakes, we talked about unnatural ultra low hairlines.
Yes.
We've talked about operating on a patient that it's not appropriate in. What's your third top?
Well, again, this comes back to what we're seeing, the more is better concept. So we're seeing patients come back now that literally have transferred their baldness from their upper scalp to their lower scalp because they've had so much harvested in some of these clinics, particularly overseas, but also in Australia, where it's now see-through on the back of their head. There's more skin than hair on the back of the head. And that's missing. The key subtlety of it is to be able to reduce the amount of hair on the back of the head and boost the amount of hair on the top of the head without making either of them look terrible.
Correct.
So that's the other huge mistake I'm seeing.
And that's just unfortunately, that's happening, and we're seeing that a lot more frequently now. And I think it's just a law of economics, really, isn't it? Because in a lot of these places, the cost of doing the procedure has dropped in a competitive marketplace. And so the only way to make more money is to offer more grafts.
And I've seen an advertisement in one of these clinics which astonished me because it said unlimited grafts.
We had a patient.
Unlimited
Remember,
grafts.
that was about sort of 6-7 years ago, isn't it? Went overseas and had unlimited grafts.
So considering there is a limit to how much hair is in the donor area, that does seem a little counterintuitive to actually have advertising telling you that there's unlimited grafts. So I suppose my mantra to a degree is, because I want to make the patient happy, is to use the least number of grafts I can to get them to their happy place where they are now and save some in the bank for what's happening in 5, 10, 15, 20 years' time, rather than the other way around. So that's my mantra, is less is more, right? I'll get away with the least number of grafts I can to make the patient happy now and make sure I preserve adequate donor for unpredictable future balding.
And this is, taking a sidetrack, but just probably warrants mentioning. That's, certainly a challenge for me, and it's a challenge for you as well, because let's say I'm losing hair and I go and I speak to this another clinic, and I get a quote from them, not dollar amount, but a number of grafts that I need.
It's always double.
It is, isn't it? So, you kind of have to really defend your stance and your position, and that takes time, right? You've got to explain that during the course of the consultation.
And some patients want us to pre-treat areas that aren't yet bald, to save them having to come back, right? So if you're going to an overseas jurisdiction for an operation, logically they're thinking they're going to get one shot at you, so they just do as much as they can on the day, and that can be quite inappropriate because we operate in an area that hasn't got significant thinning. The disturbance to the blood supply, the way the operation works, can, in some occasions, accelerate loss of the surrounding hairs, and that's a really big no-no if that happens. So again, I strongly encourage my patients to be on medication if they're going to have surgery. I strongly encourage them, and I also tell them, which is very, very important, is that there are no figures for any treatment that we have yet that is 100% effective.
There is no cure for hair loss.
There is none. And so the reality is that even if you do everything I ask you, chances are in 5 or 10 years' time you're going to have lost more hair, and we just have to deal with it as we go along. Right? This is not one fix. And I say there are very, very few patients in my practice that have one lifetime operation.
Yes. We could go on for a long time.
We certainly could about this.
Yeah.
But it's just what we're trying to emphasize to you is that the reason that we practice caution is because of our experience. We have to think on long timelines.
Yes.
We can't just think about what we see in front of us now. We have to think about 10 years. We have to think about 20 years. We have to think about 30 years. And if we're trying to dampen people's expectations and get them into a different mindset, there's a very good reason for doing so.
And I think if you're in the sort of space where you're looking to have a hair transplant procedure, you want to make sure that the person that you're speaking to has at least addressed these 3 points.
Yes.
All right? In some way have gone, right, well, we've considered all of those things, and this is, what the decision, or this is the plan, taking all of those things into account. If you haven't, that should raise alarm bells.
Yes.
Hope you found that helpful. It's a really sort of, there's a lot of issues and it's a lot to comprehend, and that's why it's really important to try and get good advice when you're making this decision.
And not make a rushed decision. A consultation should canvass all of these options and then you should have time to go and consider the pros and cons. There's always a pro and a con for what we do.
Yeah.
And it's critically important that you don't rush a decision about these things. You need to think about them carefully. You need to understand what future hair loss can do. And then you need to make an educated decision over time as to what the cost-benefit analysis is to you and what the risk-reward ratio is.
Yes.
But that said, if we consult our patients properly and we manage them properly, 98% of them are thrilled.
Yes.
Right. If we get unhappy patients, it's probably our fault for having let them keep unrealistic expectations about what was happening.
Yes. Good. So I think that's been a very thorough discussion on that topic. I hope you found that useful. Like I said, there's a lot there to unpack.
But we're very uncomfortable operating on very young people. So that's a take-home message, right? So if you're sitting there and you're under 23 years of age or 25 years of age, don't think that makes you a great candidate because you're that young. There's a lot of thought that has to go into it when you're operating on someone that young.
Absolutely. All right. Well, thanks again for watching, and we look forward to seeing you on the next episode. Please remember to like and subscribe to the channel.
Thanks, everybody.